Greetings and bienvenidos. I would like to welcome you to the CHCI Health Summit session on maternal health, achieving health equity in the Latino community. My name is Heidi Correa Encarnacion, and I am the general trainer and consultant at Anthem Indiana Medicaid for the past 3 years. I am also a proud member of the CHCI Alumni Association. On behalf of CHCI, I would like to thank the Blue Cross Blue Shield Association, Bayer, Merck, Planned Parenthood Federation of America, and the American Hospital Association for their generous support of this session. The maternal mortality rate in the United States is alarmingly high, particularly with women of color. Every 12 hours, a woman dies from complications from pregnancy or giving birth, according to the Centers for Disease Control and Prevention. Black and American Indian Alaska Native women are about 3 times as likely to die from a pregnancy-related cause compared to white women. While the rates for Latino women are lower, access to health equity to prevent avoidable maternal morbidity and mortality remains a challenge in our communities. Please join our expert panelists as they discuss proven practices and recommended policy solutions to achieve maternal health equity for Latina mothers. To lead this important discussion, it is my distinct privilege to introduce Congresswoman Jamie Herrera Butler, Congresswoman Xochitl Torres Small, and our moderator, Stacey Stewart. Congresswoman Jamie Herrera Butler was first elected to Congress at the age of 31 to represent Southwest Washington's 3rd District. She's also the first Hispanic in history to represent Washington State on the federal level. She co-founded the bipartisan Maternity Care Caucus, the first of its kind in Congress, and has been a champion for maternal and child health. Most notably, Congresswoman Herrera Butler successfully spearheaded legislation that was signed into law to address maternal mortality, the largest step Congress has taken to prevent moms from dying during pregnancy, childbirth, and postpartum. Congresswoman Xochitl Torres Small represents New Mexico's 2nd Congressional District. She is committed to tackling the unique issues facing rural communities, like those in southern New Mexico, including healthcare accessibility, infrastructure development, and job growth. During the 116th Congress, she introduced bipartisan legislation, the Rural Moms Act, to combat poor health outcomes for new and expecting mothers in rural America. We are honored to have a moderator who is a leader in the industry, Stacey Stewart. She is the president and CEO of the March of Dimes. As head of the organization, she is leading the fight for the health of all moms and babies. Under her leadership, the March of Dimes is working to combat structural racism through advocacy, research, and programs, including implicit bias training for healthcare workers. I hope you enjoy this important and timely discussion. You can continue the conversation on social media using hashtag CHCI Summit. Now please welcome Congresswoman Jamie Herrera Butler and Congresswoman Xochitl Torres Small.
Hi there, Congresswoman Jamie Herrera Butler here. Thank you for inviting me to speak at the Congressional Hispanic Institute's Health Summit and for focusing on strengthening our nation's maternal health, which will benefit Latino communities all across this nation. Now, it may be of no surprise to some of you, but the United States has one of the highest maternal mortality rates in the developed world, and statistics are particularly grim for women of color. In fact, we're the only developed country that's trending the wrong way, with deaths increasing. We also spend more per capita than any other industrialized nation on pregnancy and infant care, yet more than 700 moms' lives are cut short each year due to pregnancy-related complications. At least 60% of those are avoidable. Now, as a mother of 3 and a Hispanic myself, this alarms me, and it should alarm everyone, because you either are a mom or you have a mom. It impacts us all, and I know we can do better. That's why I rolled up my sleeves in Congress and co-founded the Maternity Care Caucus alongside my friend and colleague, Lucille Roybal-Allard, to focus on health outcomes of moms and babies and to help stem the growing maternal mortality crisis. One of our first caucus wins was getting the FDA to allow corn masa to be enriched with folic acid, the same way that white flour has been for decades, which we know helps prevent birth defects. Now, I'm proud to say that our efforts together have led to passing landmark maternal health legislation, the Preventing Maternal Deaths Act, which was signed into law in 2018. This legislation was critical in helping to understand the epidemic of maternal mortality that's plaguing communities all over our country, and disproportionately women of color. Another step we are taking in the Maternity Care Caucus is shoring up midwifery education and ensuring that the workforce better reflects the communities they serve. Congresswoman Roy Ballard and I have introduced the Midwives for Moms Act, which would establish funding streams for midwifery education and focus these resources on students from minority or disadvantaged communities. Now, while these are just a couple of the critical steps being taken to help reduce maternal mortality and improve maternal health for Latina mothers out there, we still have a long way to go. We must find common ground and work in a bipartisan fashion to help strengthen our healthcare for moms and babies across this country. And I'm committed to doing just that. Again, thank you for inviting me to speak, and I hope you have a successful summit. Take care.
Hello, Congresswoman Xochitl Torres Small here. I've had the honor of serving New Mexico's 2nd Congressional District for almost 2 years now. Every time I'm home, I hear from constituents who struggle to access affordable health care close to home. Too many have to forego necessary care because they can't afford to get to a doctor's appointment hours away. In rural areas, pregnant women must spend hours on the road and often cross state lines to get the prenatal care necessary to bring healthy babies into the world. As some of you may be aware, the United States has some of the highest maternal mortality rates in the developed world, with pregnant women and new mothers in rural areas like the district I represent facing significantly higher chances of dying from causes related to pregnancy or childbirth compared to their urban counterparts. It's why I've been focused on solutions to address the maternal mortality and morbidity crisis, to help expectant and new moms in rural America get the pre- and postnatal care that they so desperately need. I'm proud to have championed legislation like the Rural Moms Act during my service in Congress. Expectant mothers should have the peace of mind that no matter where they choose to start a family, they will have access to the resources they need to bring healthy babies into the world. My bill is a welcome step in making that a reality by expanding telehealth access and bringing additional OBGYNs directly to rural communities like the ones I represent. As parents know, a lot goes into giving a baby a healthy shot. Pregnant women should have easy access to a doctor, midwife, or nurse practitioner well before the due date to work together to build trust and execute an individualized care plan for the big day. Instead, hospital officials tell me that all the time women show up to the emergency room without having ever received any prenatal care. This can't continue to be the reality for rural America and Latinas that call it home. I hope today's discussion spurs creative connections and policy solutions to address one of the most pressing issues facing new families across the country.
Well, welcome everyone. My name is Stacy Stewart, and I want to say a hearty welcome to everyone, and thank you for joining us for this afternoon's Congressional Hispanic Caucus Institute's Health Summit. I'm Stacy Stewart again, President and CEO of the March of Dimes, and it really is a pleasure for me to serve as your moderator this afternoon. I think we're going to have a fantastic conversation about some of the issues around maternal health that we are facing in this country. And before we get into that and introducing our panelists, I first want to say thank you to Congresswoman Jamie Herrera Butler, Congresswoman Torres Small for sharing such thoughtful messages with us and for framing the issues so well for our conversation for the rest of the afternoon. You know, right now, the U.S. is considered one of the most dangerous developed nations in the world in which to give birth. And the issue is particularly true for women of color and for Latina women in particular. We have a devastating maternal mortality rate in this country that has doubled over the past 25 years. And right now, we are not doing well by moms and babies in the U.S., especially moms and babies of color, and especially Latina women and Latino babies. Our conversation today is going to cover the barriers that Latina and Hispanic women face when it comes to general health, their general health, and maternal health. But we're also going to take some time not just to talk about the problems, but actually talk about some of the solutions, especially some of the policy solutions. So as we get into this conversation today, We hope that it'll be as interactive as possible. We hope that, again, you'll use that chat function and send in some questions, which we've already gotten a couple so far. So thank you, and we will try to get to as many of them as we possibly can when we get to the question and answer session. Also, if you're on social media, please use the hashtag CHCI Summit, hashtag CHCI Summit, as you're sharing your thoughts on Instagram or Twitter, and we'll get into it. So to support the conversation today, I want to introduce our panelists. First up will be Dr. Yasmin Wadan, who is a Senior Medical Director for U.S. Medical Affairs in the Bears Women Healthcare Division. Dr. Wadan, thank you for joining. We're so pleased to have you. The second is Dr. Zapatli Mendoza, Director of Latino Leadership and Engagement at Planned Parenthood Federation of America. Zapatli, thank you so much for joining us as well. And then we also have Elvia Provencio, the Senior Director of Government Programs, Clinical Operations with Blue Cross Blue Shield in New Mexico. So if we could bring all of our panelists, hi, great to see you. And we could bring all of our panelists into the conversation. Great, I think we're all here now. First of all, it's great to see everybody, and thank you for your time today. I'm going to start with Dr. Wadan. You are an expert in these issues as the Senior Medical Director for U.S. Medical Affairs at Bears. And obviously, we just talked about the maternal mortality rate among Latina and Hispanic women, which is 11.5 deaths for every 100,000 live births, which actually is slightly lower. Still incredibly disturbing and unacceptably too high. But actually lower than the national average for maternal mortality. These are still very disturbing statistics, and it's something we all need to address. So Dr. Wadan, can you just frame for us a little bit about it? How did we get to this place where our maternal mortality rates, especially among Latina and Hispanic women, are so high? How did we get here today? Can you just sort of set the stage for us?
Thank you so much, Stacy. It's my pleasure to be here with you and the other panelists today. So I think it's important to recognize and point out that maternal mortality is part of this sort of broader picture of women's health, right? And I think women's health, there's a disparity among women's health, particularly among women of color. And I think that feeds into what we're now seeing in these, as you said, disturbing sort of statistics around maternal morbidity and mortality. And so an important recognition from our perspective is to understand that we need to sort of correct some challenges that we faced from a women's healthcare perspective, and face some of the challenges and gaps that are existing in terms of barriers for women. Again, women of color are at greatest risk in terms of accessing good education, accessing quality healthcare when it comes to their basic women's healthcare needs to begin with. I can tell you, you talked about some of the statistics around maternal morbidity and mortality. Unintended pregnancy rate is 50% in the United States. And if you start to break that down in terms of women of color, it's actually higher within those communities and within the Hispanic community. So I think that's an important piece that we can tackle together. And my hope coming out of this panel is that we realize that we're all sort of a piece of this access puzzle, and we all play a really important part in bridging gaps and breaking down barriers that exist in terms of, again, access to quality healthcare for these women and women of color.
I think it's a great point. I mean, I think we see that as well at the March of Dimes, where so many of the issues and the poor outcomes we see with respect to women once they're pregnant or even postpartum really stem from health, the quality of their health care availability, access to care, and their overall health even before they're pregnant. So focusing on mom and baby health starts with focusing on women's health. And that's true for all women, especially true for Latina and Hispanic women. Before I turn it over to Zapatli, just one more question, because obviously, if things were bad before the pandemic, they've only been made worse because of the pandemic. And I think we're seeing that. We've been seeing so much covered in the news and in the media about the disproportionate impact of COVID, the pandemic in communities of color, especially in the Latino community. So can you talk a little bit about what you're thinking and seeing in terms of the impact of COVID-19 on maternal health, what we're seeing now and what we are likely to continue to see as we move through the pandemic?
Yep, that's an excellent point, Stacey. You know, moments of crisis sort of shine a light on healthcare disparities that have always existed, right? Because they come to light and they're sort of heightened or made more acute by a crisis situation. I can tell you, we saw similar trends when I worked with Zapatli and Bear worked with the CDC Foundation on the Zika crisis in Puerto Rico, right? These pain points or these disparities tend to come to light. And I think recognizing them and addressing that there needs to be a solution that starts from, sort of the ground up in terms of addressing quality healthcare for women is an important first step. And understanding that this will not only help us get these women through the crisis, but also sort of address their needs outside of a situation of crisis and improve healthcare overall for women who, decide to have a family or who decide to hold off on having a family.
Thank you so much. And Sapali, I want to pivot to you because one of the things that Dr. Wadan talked about are some of the barriers to healthy pregnancies and outcomes. And obviously, to say that we have health inequities in this country is really an understatement. But it's something we have to continue to call attention to because until we actually do things differently in this country, we're going to continue to see these kinds of inequities persist. So, can you just break down a little bit more when we talk about the real barriers that affect health pregnancy outcomes in the US for Latina and Hispanic women? What do you see as some of the biggest barriers that women face?
Yes, hi, Stacey. Thank you for hosting this panel, moderating the session, and we're really happy to be here on behalf of Planned Parenthood Federation of America. And some of the things that I like to highlight to build off of what Dr. Wadan has shared is the barriers that sometimes we don't talk about, but that is very critical to the overall well-being of our women that we serve, and that is the racism, cultural incompetency, and language barriers that are some of the top contributors to health disparities, and that overall drive and continue to shape the systemic racism that we see in our healthcare systems. And that is something that we at Planned Parenthood are very much committed to in addressing and driving in partnerships with all of our different partners in addressing these issues that come up. One of the things that you shared about those risks for pregnant women, and in particular Latina women, are research has shown that stress is a very much a big factor in elevating risk for preterm birth. And prior studies have also suggested that anti-immigrant policies and actions can stress immigrant women and or make them less likely to seek prenatal care. And although most Latinas that live in the U.S. are citizens or otherwise documented immigrants and would not face immediate direct threat to tighter policies around undocumented immigrants, however, they're very much likely to have close friends or family members who are threatened by such policies, which then puts Latinas at risk for preterm birth because women, may not feel comfortable seeking out these prenatal care services, which we know that they are likely to, if women don't receive prenatal care, they're 3 to 4 more times likely to suffer pregnancy complications. And on top of that, Latinos overall are estimated to have less likely to have access to insurance coverage, which then puts prenatal care at a risk. And these are some of the barriers that we are looking to at Planned Parenthood to continue to work on and address. And and frankly, another issue that comes to realization is that undocumented women, there's really no way, there's no realistic pathway for them to gaining coverage, and that is why it's really important for the work that we're doing in advocating for eligibility for undocumented individuals to gain Medicaid and private coverage options through for essential services, right, through the advocating of the HEAL Act, or also known as the Health Equity Access Under Immigrant and Women Law for Immigrant Women and Families. And that is definitely one of our priorities in order to move forward to ensure that all women have access to the appropriate healthcare services that they need to have overall healthy well-being in order to have a healthy pregnancy and birth outcomes. So those are some of the things that I wanted to highlight and bring forward to the discussion.
You know, you're really pointing out something that we talk a lot about as well in our work, which is a lot of people think that you solve health by fixing what goes on in the doctor's office, and we all know that it's really important that that people are able to get to a doctor, to have high quality care, and be seen by a doctor for prevention and as they need it. But 80% of our health is not determined by actually what goes on in the doctor's office. It's determined by how we live. And that's what we call those social determinants of health. And you started to touch on that a little bit, but you know, one that if we could just kind of go a little bit further on it, because during this pandemic, we have seen a steep rise in unemployment among Latina and Hispanic women, from 5.5% to 20.5% between just February and April, and that's in just that short period of time. And of course, we've seen unemployment persist through the pandemic. So, tell us a little bit more about what your concerns now are for Latina and Hispanic women now through the pandemic, as more women are unemployed, as more women are living in congregate settings and very dense housing settings, and may be facing eviction and so many other challenges that are going to be impacting their health. What do we need to do right now to sort of pay attention to those issues as we're in the midst of the pandemic right now?
Yes, all those barriers, and then we add on COVID-19 on top of it, just makes access to services even much more difficult and challenging for women, and especially to, women who depend on public transportation or friends and family to help them get there. It makes it a lot more difficult. So some of the things that we're doing to ensure that, there is continuing access to sexual reproductive health services is that we've always provided telehealth services, but we know that sometimes that in itself is not sufficient. But we, during this time, we have ramped up even more and assisted our affiliates, our healthcare centers, to have the technology they need in order to be able to serve our patients through telehealth services in English and in Spanish, whether it's by video or phone. I know that in preparing for this discussion, we talked about how that even though that video and telephone's available, it's still there might be a lack of privacy to even have those discussions, right? To have a discussion with a physician on the phone, especially if it happens to be one of our centers that may not have the services vendors on site or vendors through our system to be able to connect with, to navigate the system. And so we're always trying to create opportunities for women to have access with assistance from those that they feel most comfortable with. So in order to expand access to healthcare services, we've also built out and trained out promotores, our health educators that have become more even crucial during this time. Our promotores have been out in the field connecting with families, and they've also had to change how they connect with the women on the ground. They, also have to switch to Zoom or to YouTube or Facebook to reach the community telephone. And so our staff has become even more creative as well in ensuring that they're connecting with the community to ensure that they're having the resources and access to the services that they need during this time. In order for us to further facilitate and create connections with our community members, we during the summer we launched this new program called Sexed en Casa, which it's a web-based platform that provides tools and resources to Spanish-speaking parents to be able to navigate the reality of talking and taking on sex ed at home during this time of COVID-19. Those are some of the things that we're doing to ensure that we're able to connect with parents, we're able to connect with women, to be able to connect with young folks. Just last month, we launched Chatea Textea, which is a new bilingual program aimed at reaching bilingual folks and reaching them in a way that's culturally competent manner, and that it's also, purposely ensuring that it was developed by folks that are not only Spanish speakers, but also are Latino, that understand the culture, the myths, the taboos that come around the discussions around sexual reproductive health, and making sure that it's a powerful and authentic tool so that it's relevant to young folks during this time. So that's how we're continuing to move our work forward, to stay connected with our our patients, our supporters on the ground, and we want to make sure that we're are accessible to them during this time.
That's really great and so important. So, gosh, you guys are working overtime, trying to tackle a lot of things at the same time. Elvia, I want to
Yes.
turn it to you. And, we've got a lot of women leaving the workforce, which means they not only are disconnecting from their jobs, that they may also be disconnecting from their health care as well, their health coverage. Um, and so, what are you thinking about? You're at Blue Cross Blue Shield. How do you think about what we should be doing in terms of certain policies to make sure that we have a more equitable healthcare system for women who are inside a traditional workplace, work setting, those outside of it? How do we make sure that women don't have to go without coverage? I mean, even outside of the pandemic, just in general, how do we need to rethink this issue of access to care and access to coverage?
Hi again, thank you. So, Blue Cross Blue Shield has some initiatives moving forward right now where we are looking at policy, first of all, to extend Medicaid expansion from the 60 days to the 365 days. And so, Blue Cross Blue Shield is very active with that expansion currently. We also are looking at our immigrant and our refugees that are coming into New Mexico, and we have provided coverage for refugees. We have over 400 refugees in New Mexico that we are providing coverage for to make sure that they do have the coverage that they need, especially for pregnant women and for teen pregnancies. We know that a lot of our refugees who came to New Mexico had very serious pregnancy conditions. And so we are looking to make sure that they are taken care of through coverage with Blue Cross Blue Shield. Ms. Mendoza mentioned that some of our patients do not have access to care because they don't have transportation. So in New Mexico, Blue Cross Blue Shield has partnered with some of our community resources wherein we bring the healthcare to them. We have a community home visiting program where we bring nurse practitioners to the women's home, whether they're refugees or whether they're regular citizens of the United States already, and we bring the care to them so that they don't have to go out or they don't have to find transportation. If they will have us in our home, we take a nurse practitioner there, we guide them through their pregnancy, and we also work with the children that they already have at home. So we're trying to look at the policies for pregnancies right now. Blue Cross Blue Shield has been very involved with that.
That's great. That's very encouraging. I want to go to, and I'll just kind of open it up to all of the panelists, some questions, and then we'll get to the questions that are coming in online, which I'm really pleased to see. We've got quite a few. So rather than me just posing questions to you, I'd rather much hear from the people that are listening and find out what they care about. But there is one question I want to just raise because I think it has been raised previously. Zapatli, I know you raised it for sure. I'd like to actually pose this to Dr. Wadan, and then Zapatli and Elvia, if you want to chime in. I think one of the things that we have to acknowledge of why we have inequity in our system has to do with racism, discrimination in the system, and this idea of implicit bias, that even if people don't understand the role that they're playing maybe in perpetuating a racist healthcare system, they may carry their own implicit bias around serving an immigrant population or a Latina population or a Hispanic population generally, and that often can stand in the way of providing high quality health care, which I think all of us would find unacceptable. That if anyone in the healthcare system is been trained to deliver care, it should not matter the language they speak, the country they come from, the community they live in, the zip code they live in, or what they look like, or what ethnicity they are. It should only matter that they have a healthcare need that needs to be addressed. So what is it, how prevalent do you think the issue is of implicit bias, like Wadan? And then what do you think we need to do about it in this country?
I mean, I think the statistics speak for themselves, Stacy, right? Implicit bias exists, and it translates itself into some of the unfortunate numbers that we see around maternal morbidity and women's health care. And I think, we have to sort of take a step back and as I said before, understand, and you heard the amazing examples that my colleagues on the panel mentioned, take a step back and understand how we can work to change that, right? For example, on the Bear has partnered, and we've recently launched a We Are For Her campaign, where we partner with Direct Relief to support safety net clinics that serve women who are underinsured and might not have access to other types of care. But through this partnership, we're able to provide access to not only contraceptives for these women, but also grants for their providers to help them address issues like, cultural competency. I know one that hasn't been announced yet, but I'll share with you, will go to help a particular clinic in a rural setting, as was discussed before, but also it specifically will help them to set up a program to address non-English speaking patients from a telemedicine perspective, right? Helping them in that manner. And I think if we importantly recognize these issues and try to implement solutions and bridge these gaps, it will go a long way in solving for the implicit bias and the healthcare disparities that exist.
That's great. Zabatli or Elvia, would you like to chime in?
Yeah, I think the other thing too that I'd just like to add, which I know I've heard Dr. Wardon speak about multiple times about, so I feel confident in bringing this up and not putting her in the spot, but I know I've heard her speak very highly of the importance of training providers during their medical programming and educating them about cultural competency, teaching them about bedside manners, and the importance of having that embedded in part of their education system so that they are, being trained and acknowledging the differences that are the different cultures and the different myths and taboos that people come with and when they seek their care. And so I think that's really important that has been addressed. And I know that it continues to be built into different medical residency programs.
I think that's right. There's another aspect of this too, and you all have sort of touched on it with home visiting programs and things like that. We did a study at the March of Dimes that was called Nowhere to Go, where we found that like food deserts, there are maternity care deserts. There are about 35% of all counties in the country that have no access to obstetric care. No hospital that offers obstetric services, no OBGYN, no certified nurse midwife, and no birthing center. And these are largely in rural areas in the country, and where we will have a significant Latino population. They also are in some urban areas as well. And so, Elvia, I just would like to hear, it's interesting. You can have health coverage, right? And still may not have access to care simply because you live in a place that, it may take you an hour in some rural counties to get to the nearest provider. If you have a high risk pregnancy, that certainly is putting that mother at risk, that pregnant woman at risk, and maybe putting her baby at risk. So what do you see we need to do differently in the healthcare system? I mean, do we need to be thinking about other providers who can provide culturally competent care, other providers beyond just traditional doctors at hospitals that can help women, especially if they're in a low risk pregnancy situation? What are should we be thinking more innovatively about how we actually support better maternal and infant health outcomes, and how would we do that?
Absolutely. And one of the things that Blue Cross Blue Shield is doing at this time is in New Mexico, we have a lot of rural and frontier areas where you say it's more than 60 miles to get care, and especially for these pregnant women. So what Blue Cross Blue Shield has initiated is a community paramedicine program where we have paramedicine ambulance type services that go to the member's home. We have the frontier areas. For number one, they can't do telehealth because there is no internet service. There is no cell phone service. So we're looking right now at specifically pregnant women who have hypertension, who are at risk for toxemia, wherein we send our paramedicine folks out to their homes to take their blood pressures and monitor their blood pressure, teach them about what they need to do when they feel certain symptoms, and to call, if they can get to a phone, the paramedicine folks who they have established a rapport with, to bring them then to the nearest physician or to the nearest midwife or whomever it is that can provide the care. Again, we're trying to expand the home visiting program to the frontier areas. It's a pilot program right now where we are in the rural areas, but we're trying to make it a bigger program for 2021 so that these women can receive the care that they need.
Great. We need that kind of innovation. Thank you so much. Since we
And
do have
Stacey,
a lot of, oh yes, go ahead.
I was just going to add that one of the things too that we don't, we were talking about other providers, is doulas as well. That is, really something really important also for Planned Parenthood at our state level with our clinicians and advocates and supporters. We've been on the forefront of advocating for doula coverage to be included part of the Medicaid program to ensure that that women do have a voice and advocate while they're going through their labor and delivery. As we know, women are occupied with other important things, of which is delivering the baby. And so, having someone to be there to advocate for them is very important. We know that research has shown that doulas have played a very important role in ensuring to reduce some of those negative morbidities and mortality rates that we have seen among women of color. And so that is something really important. And one of our success stories has been that we are a member of one of 13 affiliates in the New York area that has been a strong advocate, and now the New York Medicaid program includes doula coverage. So that is one of the things that we have definitely with our partners have won and continue to look forward to being able to build that in across other Medicaid programs.
That's excellent, and we agree with you. Expanding doula care and midwifery care is really, really important. In addition to telehealth services when they're available and when women can access them. So since we've got quite a few questions, I think maybe we'll turn to some of the questions that have come in on the chat. And I think they're really good. So let me just start with the first one from Elizabeth. And her question is, what do you think is the current maternal health policy that is negatively affecting Latina mothers? Or probably the one health policy that's probably the most harmful? And so Zapatli, do you want to take that? And maybe Dr. Wadan, do you want to follow up on that?
Sure.
Go ahead, Zapatli.
I would say that one of the things that, speaking from our healthcare system, would be definitely that our immigrant women are not covered, just in general, immigrant are not necessarily eligible for coverage. There's a lot of states 5-year eligibility wait period that before you can even become, once you're fully documented, that you even have access or eligible to Medicaid services. And so, that is one of the things I think that we don't have universal healthcare access, and that contributes to some of these in our healthcare system to health disparities. And so that is one thing that we're definitely advocating to ensure that especially undocumented women are included in having access to and expanding to healthcare coverage.
Absolutely.
I mean, I would just add, Stacey, this is not necessarily policy, but I think an important aspect to consider is education, right? Tools and resources to help educate women in general, especially women of color, around what their options are, right? Because when we do that, we arm them with information to make powerful decisions about their lives. And the more that we can help to support, the providers that see these women and help educate them and close the gap there, I think the more we, again, break down the barrier for these women, arm them with information and education that helps them make powerful decisions and strong decisions about what's right for them, their lives, and their families moving forward. So that's I think, an important thing for us to keep in mind.
I think so too. I think one of the things, and I'll just add to it, that I agree with all those points around education and then coverage. And I think one of the things that we're pushing for very much is to make sure not only women getting the coverage before they're pregnant, so they can really do a good job in planning for when they get pregnant and being prepared for pregnancy, from a health perspective, but also making sure that coverage extends through the pregnancy and then at least 1 year postpartum. So we still have some ways to go in terms of making sure that if those chronic health conditions are impacting their health and were impacting it before they were pregnant, they may have been made worse as a result of the pregnancy, and many of those women still need follow-up care for at least 1 year after the baby is born, where 1/3 of all maternal deaths happen 1 week after the baby is born out to 1 year. And so if you drop women from Medicaid or from coverage 60 days after they've had the baby, you're going to leave that woman very vulnerable to not being able to manage her health. And may have very chronic health conditions that may threaten her health, may have other issues around mental health and may need support with respect to that as well, which we haven't even talked about and we probably should touch on at some point. But there is another question. I think there was one question that came in around based on the data, what role does clinician bias? We talked about implicit bias, so hopefully we kind of covered that. But another question has come in around what steps are being taken to assure that there will in fact be equity in regards to receiving adequate health care for Latinos. And I guess the answer to that is there are some steps being taken. And, we just heard the congressional members who've been great advocates for making progress on maternal health. Congresswoman Jamie Herrera Butler, one of the major sponsors for the Preventing Maternal Deaths Act that was passed into 2018, she's been one of the biggest champions in Congress with respect to improving outcomes with maternal health. So I would say that that's one step, but I would say, are there some steps right now that you think are moving us in the right direction towards equity? Obviously, we're all agreeing that more will need to be done, but are there some steps that you are encouraged by that are moving us in the right direction? And I'll start with Elvia, and then anyone else can chime in after that.
Yeah, sure. So for Blue Cross Blue Shield and my team specifically, I work very closely one-on-one with my team and with the pregnant women. And many Latina women feel that they are made to feel ashamed with their pregnancy, especially with young women. And they also do not seek care because they're monolingual. They only speak Spanish. We don't have education that Dr. Wadan had spoke to earlier. Is we don't have education in Spanish. We don't have brochures. We don't have pamphlets. We don't have videos that we can share with them that are in Spanish. Blue Cross Blue Shield is working to make sure that inequity is minimized by producing education both in English and Spanish, especially for those women that are monolingual. We also are looking to promote videos, TikTok videos, especially for the teen pregnancies, because that's what they like. That's what they're into now, the social media, and provide those videos in Spanish. We have lots of them in English, but we don't have them in Spanish at all. So we're looking to provide more education and information in their native language so that we can reduce and minimize those inequities.
Yep. I totally agree. I would add, I think for my perspective, it's two things, right, Stacey? Number one is outright acknowledgement that there is a problem, right, that exists and that we need to fix it. We need to work on making this better, making this situation better. And number two, realizing that it's not going to be a silver bullet. It's going to take all of us that are important pieces of this access puzzle to help bring solutions and quality solutions to these women.
Absolutely. I want to ask another question that's come up too. The question from Mercedes is contraception an efficient strategy to reduce mortality in Latino women? Dr. Wadan, would you like to take that first? And then Zapatli and others can chime in.
Sure, happy to address. So the question around contraception, again, I'll take it one step back, and it's about providing education for women with regard to their reproductive life planning. Women should be armed with education to make powerful decisions about when to have a family or if they want to have a family. And we know that short interval pregnancies, for instance, have some associated risks. Right? The ACOG, the American College of Obstetrics and Gynecology, recommends that women wait at least 18 months before they have another pregnancy. and unfortunately, particularly in women of color, that length of time, inter-pregnancy time can be shorter, which then lends them to some increased risk with their future pregnancy or with their health in general. So helping women understand what their options are, where they can implement their options to then potentially put them at a better outcome down the road can definitely help in this instance, particularly as it pertains to contraception and reproductive life planning.
Other panelists, feel free to jump in if you'd like to
I
respond.
also, from the insurance perspective, from Blue Cross Blue Shield, so while we don't have the expansion for Medicaid yet, it's only 60 days postpartum or after they have their baby, and we're working very hard to expand to the 365 days. So while we don't have that care that's expanded, we do have the opportunity for contraception and provide that education, as Dr. Wadan was talking about, arming them with the information not to get pregnant within the first 18 months. And we're providing different types of access to contraception. So it's not just oral contraception. There's the subcutaneous contraception. There's different types that we are hoping to open up more so that they do have that access for contraception, especially right now for teens, so that they can do their family planning and maybe get through their high school years before they have their next baby.
And I agree with what everyone has shared so far. It's very important that women have the education so that they can provide an informed decision of how they like to, have their life plan, their family planning plan. So that's really important. So I agree with what everyone has shared thus far.
See if I could just add one other piece. Sorry.
Sure.
I was just
No, go ahead.
I was just going to add that I can't underscore how important the education is, because as I mentioned before with our partnership with Direct Relief and these clinics, one part of it is providing the contraceptives, right? But the other part of it is meant to address the education, because you can have the contraceptives there in the clinic if the woman is not armed with the right information and education to seek out that option. It really means not very much, right? So you've got to educate her, help her understand where this fits in her reproductive life plan, and then again give her the opportunity to make that decision for herself.
Absolutely. There's a really interesting question that has come in from Javier, who's asking, having big personalities is a well-known Hispanic trait. How do you help your patients when they are hard to get through to? I guess. So strong-willed women, how do you help communicate with them and help them understand what their options are and better inform them? Dr. Wadan, do you want to start?
I will start, and I'm smiling because when he said that, I can see my patients were like that in my mind. These particular patients of color, they are, and I think women in general are the backbones of society and their families as a whole, right? And so they are strong-willed and they have big personalities. But I think bringing it back full circle for them, helping them understand that this will play an important part in impacting your life, not only your life, but your family's life and generations on, resonates with them. Helping them understand that and put it into perspective for them really, really works for them, and making them part of the discussion and not, I forget who said it, but not sort of talking at them with the information, but making them part of the conversation is, I think, key here.
Definitely agree. It's meeting them where they're at, right? Like Dr. Rodon said, sharing
Exactly.
resources, having them be part of that planning process, having them, be a part of that discussion and dialogue, and being able to make that decision in partnership, not in favor, or not doing it on behalf of their whatever you think might be their best interest, but what they know to be their best interest for themselves and their family is most important.
There's another question around, and go ahead, Olivia. Sorry.
Oh, no, that's okay. I was just going to say that one of the things that my team has experienced is when we have pregnant women with gestational diabetes, for example, Latino women love their Mexican food, and when we try to work with them about changing their diet, perhaps to help with their diabetes or maybe with obesity, they don't want to have anything to do with that. But we've involved them with, New Mexico has a diabetic cooking class. So we've invited them to the diabetic cooking class so that they can take part in that. And it's going to, what Zapatli was saying, meeting them where they're at. And so they can adjust their meals and tweak them just a little bit, not to take the authenticity of the cuisine out, but just so that they can tweak it enough to make it a healthy meal. Because you're right, they don't want that taken away from them. So just wanted to add that.
That's a really tough change to make, but I think it goes on with education, understanding how your healthy eating can lead to a healthier life is really important to understand. There's another question which is definitely a big issue with respect to maternal mortality. We certainly have seen this week. In fact, the March Times just issued our overall report card on infant and maternal health, and one of the things that we've seen is that the increase in maternal age could be a big contributor to some of the poor outcomes we're seeing with respect to maternal mortality and morbidity. So there's a question that says, as women are having children later in life, is maternal mortality increasing, and how do we advise older moms? And does the issue of age ever come up in terms of advice to patients on how to think about the risks they may be facing as they get older, trying to start or expand a family? Dr. Radan?
I would say definitely, for sure. It is a piece of the conversation that takes place, right? But I think the shift here is now shifting this conversation over and making it impactful and making it sort of relevant to the population of women of color, right? Because it's not that's just layered on top of what already exists for this, the Latino and women of color population. So bringing it to the table and helping them understand that if they are, an advanced age in their pregnancy, this is additive to some of the other risks that they may be at risk for, and we're going to partner together to sort of help them avoid any challenges that may come up, even before their pregnancy or during their pregnancy or afterwards.
That's great. I want to try to get in a couple more questions here, and so maybe I'll just point it to our remaining panelists before we have to end it in the next several minutes. We've talked a little bit about the pandemic. Another question came up around COVID, and the question is, systemic health and social inequities put many minority groups at greater risk of getting COVID. What do women need to do to ensure a healthy lifestyle? And Zapatli, do you want to take that one or start with that one?
Sure. Happy to start off with that. I think one of the things that, being Latina myself, I think we do, think about our families first and taking care of them and what's important for them. But we also need to take care of ourselves, right? If we're not healthy, if we're not taking care of ourselves, then how can we take care of our families? And so, it means that when we're having a crazy lifestyle right now with, having the stress of COVID, and it really impacts how we're addressing our own health. And it might be, taking a few minutes. We were just talking about this with some colleagues earlier today. Like maybe it's just going outside and sitting by yourself for a few minutes if you can't escape going to the bathroom, right? Having a few moments for you to just to yourself, to have your own thoughts, because mental health, we didn't really talk about that a whole lot during the panel, but we briefly mentioned into it. It's really, it's been exacerbated during this time, and we have to acknowledge and be able to take some time to breathe. And, if it's taking a few minutes just to do some of that deep breathing, to breathe from our stomachs versus our chest, just taking those few minutes, even if it's 5 minutes a day, right before we start the day off, and alone in our bathrooms for a few minutes while we go out to tackle the world with our families, is a first step to taking care of ourselves and trying to minimize like what Elia mentioned earlier was like changing some things to how we cook our food, right? Our food could still be very delicious. I know that we are that we come together and in communion with our food and our culture, but sometimes we need to make some adjustments in order to have better health outcomes for ourselves and to be able to take care of our families. So those are a few things that I just wanted to bring up, because I know that it's also a privilege to, be able to set some time aside and take care of ourselves. Like, I personally I've gotten into yoga because my where I normally went to go work out has been closed, and I
It's closed, right?
never was a big fan of yoga, but now it's become part of my life. It's integral to my life, and I've actually come to appreciate it. But I know that that's also, a privilege to be able to set an hour aside a day or an hour here and every other day to do that self-care for myself.
I think that's right. We have just a couple of minutes to go before we have to end this. I just would like to ask each one of you all, if with our audience listening today, if they want to understand more about health equity issues, maternal health equity issues with Latino women, Hispanic women, are there resources that you would point them to? And what are just some parting thoughts and ideas that you would like to leave with the audience with respect to what we have to do to address the inequities that exist with respect to maternal health? Elvie, I'll start with you. If you could just keep it kind of short, just because we're getting close to time.
So I'd like to let people know that your insurance companies, not just Blue Cross Blue Shield, but there are care coordinators, there are case managers that are specifically trained in pregnancies, so they could help advocate for these health inequities, tie you into the right people, provide you with the health education that you need. So reach out to anybody, with your insurance company if you have that capability, and there's tons of community resources out there, and I'm happy to provide those if people want to reach out to me via email.
That's awesome. Dr. Wadan, what resources and what are your parting thoughts and ideas?
Thank you, Stacy. Really two things. The first is, this is a huge step, I think, in addressing the challenges that it lay before us, right? And just bringing this to the forefront and the consciousness will really help us, especially as we start to implement partnerships, like I mentioned before, the one that Bear has currently with Direct Relief, and the campaign around the Wear for Her campaign. Those would be two resources, but again, important steps in acknowledging this exists and helping to find solutions to make this to improve the care for women.
Great. And Zapatle?
I would just add that, I mentioned some of the resources throughout the discussion, like going to plannedparenthood.org. You can schedule your appointment directly there, or find an affiliate in your area to schedule an appointment, whether it's a video or in person. Being able to go to Sexed en Casa, which is of our Planned Parenthood in Espanol website as well, for those resources for parents that might need it to talk to their kids, or for our young teens and young folks that might want to talk directly to someone, an educator. They can text AHORA or AHORA to 774-636, which they can reach an educator live off of the text chat, their service that we have going on.
That's great. And I'm hoping we can make sure those are available to the audience. Well, thank you all so much. I want to just say I wish we could have had more time to engage in this conversation, but thanks to Dr. Yasmin Wadan, Zapatli Mendoza, and also Elvia Provencio for being our panelists today and providing such great information. These are really important conversations, because the only way we'll make progress on maternal health, especially among Latino women, Hispanic women, is going to be when we work together and address and acknowledge the issues and work towards change, policy change and other change as well. If you want to keep the conversation going, please please do so by sharing the hashtag CHCI Summit. We also encourage you to attend the closing plenary today on digital health, addressing the needs of underserved Latino communities. That's at 3:30 p.m. Eastern. And if you know people who would be interested in joining us for a closing plenary, it's not too late to register at chci.org. If you want more information about maternal health, please feel free to visit also marchofdimes.org. Be glad to share a ton of information about what we're doing on our end to address the maternal infant health crisis in the country. So thank you so much, and it's been my pleasure to be your moderator today, and look forward to more of these conversations. Thank you.